This guide is intended for patient coordinators. It explains how to record the careflow admission of a patient who has been referred for medical attention and how to ensure the patient is added to the medical take list in Nervecentre. The first step is to open the inpatient module of careflow. Select the Admission Requests option. On the drop-down control, select the Trust Removed and Expected Admissions Requests list. This shows expected patients in bold and patients who have been admitted or removed in grey. However, rather than clicking View All, which can return thousands of patients, we are going to search for one specific patient using the Patient Search field. We are going to find the patient's admission request record by searching for their careflow hospital number, also known as local ID. Click Search, and the patient's record should be displayed. Ensure you have the correct patient by checking their date of birth, address, and other details shown at the top of the screen. Then right-click on the patient's record and select Admit Patient. The Admit Patient screen opens. Record the patient's ward admission. Be careful to check the details and to amend any entries as necessary. Don't forget to complete the mandatory fields shown in bold, for example, administrative category and source of admission. Then click Save. This careflow action records the patient's admission to a ward. It also creates a current inpatient record for the patient in Nervecentre, which means it is now possible to add the patient to the Nervecentre medical take list. Should the document template dialog appear, you can take the opportunity to use it to print any necessary paperwork for the patient, for example a wristband or admission card. You can select then print any required documents by pressing the Submit Now button. Or you can click Cancel to exit without printing. Recording the patient's admission in careflow results in the patient appearing as an inpatient in Nervecentre. You must now copy 3 important details from the patient's careflow record into their Nervecentre record. Ideally, you will have 2 monitors to enable you to have careflow open on one screen and Nervecentre open on the other. I only have one monitor, so my applications are side by side on the same screen. Log in to Nervecentre. Then click on the drop-down control at the top left and search for the ward of the patient. Select the ward. Select the Patient Detail menu and click Select Patient. The screen will update to show all the patients in that location. Click on the patient you just admitted. Note that red entries highlight patients with similar names. Open the patient's medical take form if it is not already displayed. To do this, click the title of the form on the left of the screen, then select Medical Take from the list. You must input details from the patient's admission request entry in careflow into their medical take form in Nervecentre. Before doing this, do ensure that the patient's admission request entry is open in careflow. Click on the Medical Referral Source field in Nervecentre and select the entry that corresponds to the admission method in careflow. Click on the date-time referred to medical take field in Nervecentre and enter the same date and time as recorded in the date and time of referral fields in careflow. Go to the Note field in careflow, select and copy all the text. Then click on the Reason for Admission field in Nervecentre and paste the note you copied from CareFlow. Be aware that to paste in this box, you must use your keyboard by pressing the Shift plus Insert keys or Control plus V keys. Click Save. You can now close the patient's admission request entry in CareFlow by clicking the Cancel button. By recording a medical referral source for the patient in Nervecentre, you have successfully added the patient to the medical take list for ongoing processing by medical staff.